Throughout the month of March, we're sharing stories of remarkable women from around our region sent to us by you, our viewers. For over 20 years, midwife Kathrine Bramhall has been educating, empowering, and supporting women during the most transitional period of their lives, childbirth. And we're proud to share her story as one of this year's Remarkable Women nominees. ABC 22's Lily Sakaniwa reports from Hanover.
Kathrine Bramhall gave birth to her first daughter under the care of midwives. At the time, it was a financial decision.
We were pretty poor, and midwives were affordable.
Struggling to understand the public health care system, she felt lost and frustrated with the lack of resources available. That all changed when she met midwives Trudy Cox and Winnie Thomas.
And they saved my life.
Under their guidance, Bramhall finally saw what true health and care looked like for the perinatal time.
I used to sit in the rocking chair next to their desk for the first half hour, and I was just encouraged to talk. And they just listened.
The birth of her second daughter looked a bit more traditional.
We had insurance at the time. I went with an OB. It was a really different experience. What it gave me was a really good perspective on the value of this model of care.
Since then, Bramhall has been supporting women during the most transitional and transformational period of their lives. She received her degree from a nationally accredited midwifery school and has been performing out-of-hospital births in Vermont and at her New Hampshire-based birthing clinic.
Inasmuch as I grew up at a time when women didn't have a voice or were just beginning to have a voice, I knew that I didn't want my daughters to have that same group of options that weren't there.
Statistically, 85% of women with healthy, full-term, normal pregnancies are good candidates for an out-of-hospital birth with midwives.
Midwives do full prenatal care with the same schedule of care that you get anywhere else. The big difference is that there's shared decision-making, actual shared decision-making.
But Bramhall says her work goes so much deeper than preparing for delivery.
In this model of care, women come in with so many questions. In an out-of-hospital birth setting, what a provider has is the luxury of time.
She takes the client's ethics, culture, challenges, and hopes and integrates them into the course of their care, before, during, and after childbirth. To date, Bramhall has helped deliver over 900 babies, and she's even gone on to publish a book titled Transformation Through Childbirth.
What are the things that you want to know about? You know, what's the standard of care? What are the tests? So that at the end, when they're holding that little baby, wherever and however they are, they know that what just happened mattered, because that's where hope is born.
In Hanover, Lily Sakaniwa, ABC 22 News.